Yes, Dr. Mubasshra, Assalamu alaikum.
Assalamu alaikum. Okay, Dr. Faiza, are you ready?
Yes, Dr. Mubasshra.
Okay, can you please read the scenario?
Yes, just give me 1 minute. So here is the scenario. A 70-year-old man, Mr. Ali, is a known case of COPD and osteoarthritis. He has carcinoma bladder since 5 years, for which he took chemotherapy. Now he presented with drowsiness, confusion, and anuria for 1 week. Despite catheterization, there was no urine output. His urea levels are markedly deranged as well as his creatinine levels are very high. The nephrologist evaluated the patient and established the diagnosis of ureteric obstruction and came up with the management plan of nephrostomy. Your task is to explain the procedure to the son of Mr. Ali and manage his concerns.
Okay,
May I
so
start, Dr. Mubasshra?
yes, you can start.
Lecture
Okay.
start पे
Hello, sir. Good morning.
Good morning.
I am Dr. Bilal, one of the doctors from the medical ward. May I know your name, sir?
Yeah, I am the son of Mr. Ali.
Okay. And your good name, please?
Mr. Iqbal.
Nice to meet you, Mr. Iqbal.
Thank you.
So, Mr. Iqbal, I am here to discuss about your father's health condition, and the treating team has planned a procedure on your father, which I am going to explain to you. Is that all right?
Okay.
So, Mr. Iqbal, can you tell me what do you already know about your father's health condition?
Yes, doctor. Actually, my father has been suffering from confusion and drowsiness since last 1 week, and it is quite bothering him a lot. And that's why we are here today. And the doctors have already told that there is some issue with his kidneys. That's why.
Yes, you are very right, Mr. Iqbal. Actually, I'm going to tell you in detail about your father's condition. What happened is that your father is an old patient of a cancer of the bladder, which means that the urine, the waterworks pouch, which is called as the bladder, he is suffering from that. And he has undergone multiple chemotherapies in the past. But this time, when he presented with drowsiness and confusion, what has happened is that there is complete blockage of his waterworks out of the body, which means that he is unable to evacuate his bladder, which is due to the spread of the cancer. Are you getting my point, Mr. Iqbal?
Yes, doctor.
So because of this condition, because of the blockage of the bladder, what is happening now is that the toxic chemicals, they are getting accumulated in the blood of Mr. Ali, and due to which he is going into drowsiness and confusion and all the symptoms that he is having, and his kidneys are being affected very badly because of this blockage. And we are suspecting that he is going into a condition which is called as kidney failure. Are you with me, Mr. Iqbal?
Yes, doctor.
Okay. So what the treating team has planned to carry out is a procedure which is called as nephrostomy. You don't have to worry about the medical term. I will explain to you in simple terms what it means. Basically, because of the blockage that I have told you, that there is a blockage, that he is unable to evacuate his waterworks out of the body. So what is going to happen is that a small tube will be inserted from his skin, through his skin into the kidneys, so that to drain all of the residual waterworks which are there in his body. Are you getting me?
Yes, doctor.
Okay, so what the procedure is, basically, it is not such a major surgery, but it is a small surgical procedure in which we do that. We take with us a radiologist, which means that we will do a scan along with it. And there would be a doctor for the scanning, and there would be another urologist who will stick that tubing into the through the skin into the patient will lie lie on his lateral position, which means that he will lie on his side, and we will first of all numb the area by a local anesthetic, and also painkillers and sedation can be given via his blood, through his blood from a cannula in his arm or his leg. And after that sedation, a tube will be inserted through the skin into the kidney, and a bag will be attached with it, so that all of the urine gets drained in that bag. Is that okay, Mr. Iqbal?
Doctor, is this procedure really necessary?
Yes, Mr. Iqbal, I'm afraid that this is very necessary to save your father's kidneys at this moment, because his cancer is so advanced that there is no other option to relieve the blockage that I have just told you, that there is a great blockage at his bladder level. So it is very important to relieve that blockage by any means possible at this moment, and this is the best possible way right now for your father.
But doctor, I don't think
Otherwise,
that my father can undergo such a difficult procedure. He's too much sick. He's not conscious.
I understand. I can see that it is a very distressing time for you and your family. I can totally see that, but it is a you can say that it is a kind of life-saving procedure for him, because if we do not do this procedure, his kidneys will keep deteriorating, and it would be very difficult to save him in such a. I'm very sorry to be telling you this information, but this is a fact that it would become very difficult for us to save him without this procedure. Are you getting my point, Mr. Iqbal?
Yes, doctor. Please carry on.
Okay, so I was telling you.
Hello, Dr. Faiza.
This task that is ahead of us.
You were not audible in between a couple of seconds.
Am I audible now?
Yes, yes.
Okay, so do you have any more concerns, Mr. Iqbal?
So, doctor, can you please tell me that if you perform this procedure, will my father condition fully reverse?
Mr. Iqbal, I cannot guarantee you that your father's condition would completely reverse, but we are hoping that it would improve. It would definitely improve his kidney function, because right now his kidneys are failing badly because of the obstruction, because all of the toxic chemicals I have just told you that they are not being drained out of the body, and they are retained inside the blood of that patient, and they are damaging him very badly. And if we do this procedure, we are hoping, and this is one chance of saving his kidneys, and we are hoping for the improvement. But there obviously, there with such a procedure and with such a background history of this patient, there can be no 100% guarantee.
Okay, doctor, can you please tell
Hello.
me? Yeah. Am I audible?
Mhm. Yes, yes, you're audible.
Okay, doctor, can you please tell me that I can see that it's something very difficult to ask at this moment, but can you tell me that how long will my father live?
I cannot give you an exact number of days or weeks that your father live, but I can say that he has short time. This is all that I can say. I cannot give you, considering his cancer, it has spread a lot, and his failing kidneys too. So I can say that he does not have a lot of time.
Okay,
I'm
doctor,
sorry
two
to say
minutes are
that. And
left.
okay. Uh, Mr. Iqbal, I am going to tell you a few of the side effects that can be possible with this procedure. Minor side effects like bleeding or a slight discomfort at the site of the procedure, and pain can be there, but they are manageable with the help of medications. So there is no say no very rarely it could result in the urine being leaked inside the body, which can be dangerous, but these side effects is very rare, and our team is so much trained that we are hoping that these side effects would not happen, hopefully. So do you have any more concerns, Mr. Iqbal?
Okay, doctor, how much time this procedure will take?
It will take a maximum of 1 hour to 1.5 hours, not more than that.
Okay.
So are you willing for the procedure, Mr. Iqbal?
Actually, doctor, at this moment, I'm not willing. I will discuss it with my family. I basically need time to think about it.
Okay, Mr. Iqbal, it is your right to take all time you can, but I must tell you that considering your father, you can discuss it with your family and take your time, but you should also try to take decision as soon as it is possible and feasible for you. I can totally see that it is distressing, and such a procedure is a big news for you, but you must also consider his condition and take it as soon as possible. Is that all right, Mr. Iqbal?
Okay, doctor, time is over.
Okay, thank you, Mr. Iqbal.
Okay, okay, Dr. Faiza, it was a good attempt, I would say. But there are a few points which I need to discuss with you people, all of you people, is that in communication skills, what the PACES examiners need is that you have a communication which is two-way. That is uh, 50% or at least 30 to 50%. The surrogate or the patient should speak, or the doctor should give her or him the time to have a two-way conversation. Okay, this was one thing.
Okay.
Second thing is that in communication, basically you don't need to impart your knowledge, or it shouldn't be like a lecture. It should be a talk, like you talk with your patients, you talk with your colleagues, something like that. Okay, and another thing is that there are few words like I understand, I can totally see. Uh, I would say that try to avoid these things, because the PCS examiners may write in your feedback or your comments that this thing is a bit not so considerate. No? You can say that I can see that it is a very difficult time for you, and try to emphasize on these words, and try to and during your exam, basically you need to have those expressions on your face as well, so that it feels like a real exam scenario. Are you getting me, Dr. Faiza?
Yes, yes, Dr.
And
Mubasshra.
your voice must be a little empathetic and a little tone with ups and downs, like it shouldn't be
Okay.
like a lecture or something like you are explaining to your colleague doctor. I mean, it must be something which you are explaining to a, surrogate or a attendant of some patient. Okay.
Okay.
And another thing is that whenever the whatever the scenario it is, whenever the surrogate asks from you that how long it will take, for example, the procedure, or how long my father will live, or something which needs a time span, I would suggest, and other examiners also suggest, never give a time. Always tell it is a short procedure, it is a long procedure, it is not a long procedure, something like that. Okay, but don't try to give time 1 hour, 1.5 hour, or 30 minutes or something like that. Okay,
Okay.
and another thing is that try to avoid jargons. For example, urine is considered a jargon in some countries, so it is better that you say the word waterworks. Okay, and anesthetic is also a jargon. You can say numbing agent. Okay, and
Okay.
another word you used, lateral position. uh, One thing I want to say here is that we all are human, we make error, and sometimes if we get some scenario in exam which we haven't practiced, don't panic. Just try to be simple and try to apply all the rules which you have learned in all the communication skills. You just, if you, if some jargon has slipped out of your tongue, just say sorry and use the other word. Okay. For example, if you have
Okay.
used the word lateral position, oh sorry, it is when your father will lie in the side position, or your father will lie on his tummy. Okay. And try to avoid the word patient, that this is my father. Okay. I am talking to you, I am his son, or I am his daughter. So you should say that your dad, your father. Okay. Something like that.
Okay.
Another word you used, radiologist, urologist. The layman does not know this now. You can use kidney surgeon, kidney doctor, scan doctor. Okay, instead of
Okay.
radiologist and nephrologist or urologist. Okay, so let's discuss this scenario right from the start. uh, in the new PACES exam, the new pattern, the time has shortened. But what happens in this is that previously it was 15 minutes, now it is only 10 minutes. But what the PCS examiners and the whole team do is that they give you maximum information. For example, the surrogate will give you maximum information. So when you start this scenario and the surrogate is telling you how much knowledge he has, so you will say, instead of repeating those things, you just say, I appreciate your knowledge regarding your father's health condition. Okay. So let's start this scenario right from the beginning. When you enter the room, you will greet your examiner, you will greet the surrogate, you will say, hello, good morning, or I am Dr. Iqbal, or I am Dr. Bilal, one of the doctors in the kidney ward. Whatever your role is written outside. Your task and your role is written outside. And in the first sentence, when you were saying that I want to explain a procedure for your father. So, in actual situation, the surrogate does not know what's going on with my father. He doesn't know that what procedure. You just need to come in a bit by bit, in a small chunk of knowledge. Okay. So you will say that first you will confirm the identity. Yes, you confirm very well. After this, you will say something to build the rapport. Okay. So you will not start your conversation right from the start that your father is suffering from this and something like that. You will say, okay, nice to meet you, I hope I have not kept you waiting for too long before you see me. Or okay, Mr. Iqbal or Mr. Ali, whatever, I hope that you are comfortable in this room. He will say, yes, I am comfortable, doctor. If in the scenario, if in any scenario they tell you in the scenario that the patient is not competent, I hope you all people all know what is competent, that the patient has the right to uh, decide about his treatment, or he has the knowledge what's going on with him. Only at that time you will say that I have already, you will consider yourself that you have already took permission from your father regarding his health condition and to discuss with his daughter or his son. Okay. And for example, in this scenario, the father was not competent, father was not conscious, he was not
He
oriented
was
to
not
that.
conscious.
Yeah, he was not conscious basically. But still, when you get the scenario in the hall, they will give you a very long page, even it can be 2 pages, and you have just the time. Consider it that you have 3 to 4 minutes. Okay, don't consider it 5 minutes. Try to read it as early as possible. Underline those things because that paper will not go inside with you, and inside you don't have time to read it again. So they will write, consider yourself you have already taken permission of your father. Okay. If they write it, still you have to say that I have already took permission of your father to speak to you regarding his health condition. Is that okay with you? He will say, yes, yes, doctor, it's okay with me. So it will leave a good impression on the examiner. Okay. And then you will say, but in this scenario where the father is already non-competent, you will not say. Okay. So you will say that before moving forward, yes, you ask that what is his insight or inside knowledge regarding his father's health condition. That's very good. But if he tell you that he know everything, each and everything regarding his father, then you will just say, okay, doctor, okay, Mr. Ali or Miss Fulana, that I appreciate your knowledge regarding your father's health condition, and you will start explaining the further scenario because this is a quite lengthy scenario. You will have to discuss about his health condition, his father's health condition, as well as you have to tell about the procedure. You have to tell each and every aspect at least of the procedure. Okay. So in case if he does not do anything, he says, no, no, doctor, I don't know. I just came from abroad and I came to know that my father has been suffering from some problem and he's admitted. Then your task will be doubled. You will have to tell that Mr. Ali or Mr. Khan, whatever his name, that um I can see that it is a very difficult time for you, but we are with you in this difficult time, and we will provide all the possible help to your father, since your father has been suffering from, as they told in the start, that he has comorbidities, for example, chronic lung disease, he has some weak bones, he has cancer of his bladder, and for which he took treatment. But you will not say, if the scenario doesn't tell you that this has been a complication of cancer at this moment, you will not tell him. Okay, you will only impart that knowledge which is already given in the scenario. For example, in this case, they haven't told that this ureteric obstructive uropathy is because of spread of cancer, or whether it is acute and chronic kidney disease. So you will not touch it if they haven't told you in the scenario. Okay, Dr. Faisal.
Yes, okay.
So what will happen now? That, for example, if you know everything, you will just say, "I appreciate your knowledge regarding your father health condition. What happened in your father case is that he has been confused. We are so sorry for this. His chemicals in his blood has been raised. So that's why our treating team has decided a management plan for your father. Because in cases, you will never say that we have decided, or my consultant. You will always say that our treating team has decided. Here you can't take decision
Yes,
on your.
okay.
So you will impart your knowledge bits by bits, and meanwhile you will check the understanding of the patient, that you have already understood, Dr. Kaiser, very well. You keep on asking. This is a very good point. No? So, but another important thing, another important sentence I would like to impart, that you can ask that, I hope I am not overloading you with lots of information, because this is a very lengthy scenario. You have to tell each and everything about him. So keep on saying this sentence at least twice in your 10 minutes, that I hope I'm not overloading you with lots of information. Okay. One thing, Dr. Faiza,
Yes.
am I a bit speedy, or is it okay?
No, no, you are okay, but there is some background noise. I think someone's mic is open.
Is it okay now?
Yes, it's okay.
Okay. So, when you are trying to manage your time, that in initial at least 2 to 3 minutes, you come towards your main agenda of the communication skill. For example, here the main agenda is explain the procedure. So whenever there is any procedure, whether it is nephrostomy, whether it is some biopsy, whether it is some transplant, or whether it is some procedure like lumbar puncture, always divide your time in three portions. For example, here you will tell about pre-procedural counseling, procedural counseling, during the procedure what will happen, and post procedural counseling. Okay, so in
Okay.
pre procedure you will just tell, and another important thing which I noticed during the whole communication, that uh, always give some pauses. Okay, these PACES examiners love the pauses, especially when you are imparting too much information in a very sick patient. Okay, mostly the patients are sick, mostly the patients are towards the end of life. In communication skills, mostly there are such scenarios. So here again, you will when you were talking about that, you were telling him that our treating team has decided a procedure for your father, which is called as nephrostomy. Just give a 1 to 2 second pause. Okay, this is a golden pause, and they like it very much. And after, immediately you will tell, please don't bother with the medical terms, or it is just a medical term which we doctors use. I will be in a better position to tell you in a couple of minutes. Okay, so it is a procedure. Instead of just imparting knowledge, just ask, have you ever heard about it? uh, Mostly in most of the scenarios, the surrogate will say, no, no, doctor, I haven't heard about it. Okay, so again you will ask, do you want me to explain it to you? Because just imagine yourself that if you are in that surrogate position, if it is a real life scenario, if some doctor is telling you and you don't want to hear, huh? For example, just imagine, otherwise in exam they will always say, yes doctor, please carry on, but you should ask, do you want me to explain it to you? Yeah, for example, if you consider yourself during the scenario that the surrogate is not much attentive, or he is a bit gloomy about his father's condition or mother's condition, you will keep on asking, do you want me to tell you further about it? Okay, I hope you are getting.
Yes, I'm getting.
Okay, so now, for example, you will tell in a simple word, just in 1 to 2 lines, that what this procedure is all about. Okay, this is a procedure which will improve your father's health condition, and it will relieve his obstruction of the water work. Okay, and try to avoid the information, or try to avoid those sentences again and again. Okay, so what happens before this procedure is that your father will be admitted in our ward, and he will not eat anything before the procedure for a couple of hours, and you need to tell your doctor about any allergy to any medication which he has. Okay, and then a line will be passed in your father blood channel, in one of his blood channel in his arm, through which we can give him some injection or some medication, so that he can be kept as much comfortable as possible. Okay, so keep on showing some sympathy, keep on being some empathy. Okay, so uh, this was all about pre-procedural counseling. Just you will need to tell him that you will need some sedating medication, some IV channel. Don't use this word IV channel. Basically, you will use a line in his blood channel, and just you need to tell about some um, allergy to any medication or any specific thing you need to tell it to your doctor. Then immediately after 30 seconds of pre-procedural counseling, you will come towards the procedural counseling. You will tell, and in each and every step, you will keep on asking, are you getting me? Do you want me to continue? Okay, he will say yes, doctor, continue. Or meanwhile, he can ask some concern from you. Okay, so during the procedure, what will happen? Your father will be either lie on his tummy, or he will lie on his towards his side, and the doctor will apply a numbing cream over the site of the procedure, just to keep your father more and more comfortable and pain free. Okay. So after taking antiseptic measures, in every procedure, must tell about numbing agent, must tell about antiseptic measures. Okay. Then the what happened after the doctor will take antiseptic measures? They will make a small nick in the skin of your father, and a fine tube will be passed inside his skin towards his tummy, towards his kidney. Sorry. Okay. And meanwhile, when you are explaining this point, you will say, let me draw it for you. There will be a paper and a pencil or ballpoint, and you will draw. Because I have seen a few feedbacks of some candidates in which the PACES examiners love that the candidate draw for the patient or the surrogate. What you will draw? You will just make a kidney. You will just make for example, a line which will showing the back or the lateral side of his body, and you will just say that this fine tube will be passed through the skin inside his tummy, inside his kidney. Okay, only this a small drawing, but it will leave a very good impression on the examiner. Okay, and then you will tell that one end of the tube will be inside his kidney, and the other end will be attached to the bag outside. Meanwhile, just impart knowledge in I mean, low voice or something like low speed, so that he can grasp. All right. And then you will tell that the tube may be fixed to the skin outside, so that it doesn't get dislodged. Okay. And after that, you will just tell him about the post procedural counseling, that after this, your father will be kept under close observation. We will keep him under close monitoring, and we will look for any side effects which he encounter. If you will go like this, he will keep on asking, doctor, what side effects, any side effects? But then you will tell that, as like any procedure, it also has some side effects, but these side effects are very common. And for example, these can be pain, it can be infection, or it can be injury to the nearby organs. Okay, so or you can say that there can be leakage of the waterworks because of this procedure. But when you are telling about the side effects or the complications, right away you will tell that we have a very expert team of doctors, and they are very experienced, and they have performed this procedure many times. And let me tell you one thing, that it is a relatively safe procedure. And in our expert team of doctors, there are quite a few complications, or these complications will occur very rarely. Okay, so that you should be in a convincing style, so that the surrogate will say yes, yes, it is a safe procedure, it is a good procedure. Okay, are you getting me, Dr. Faiza?
Yes, yes, Dr. Mubasshra.
And one thing which he asked, that when the surrogate will ask, is it a really necessary procedure? I don't think that my father will undergo this procedure. Then you can see that, okay, you explained very well, but try to add one point as well, that this procedure is in the best interest of your father. That's why our treating team of doctor has decided it for you, for your father. And it is according to our local and international guidelines, and it will improve your father's symptoms. And when he was asking about the concern that how much time this procedure will take, then you will tell that it is a very short procedure, it won't take much time. Don't give a time period, 30 minutes, 20 minutes, 15 minutes, no need to tell.
Okay.
Okay, just give a vague thing. When he was asking how long will my father will live, uh, then again you will see that when it comes towards the lifespan or end of life, unfortunately, it all comes in nature's hand. We doctors are here to help your father or your all the patients as much as possible. And in the same time, you will be much more empathetic in terms of your words, as well as in terms of your face expressions and your tone of voice. That you will say that I can see, Mr. Ali, that it is very difficult time for you, but let me assure you one thing, that we are with you in this difficult time. We will not leave your father alone, and we will provide all the possible help and support which we can. So this will leave a very good impression. Even the surrogate will say that yes, they will give you full confidence. Okay, even if they do not get convinced of this procedure, still the examiner will see that yes, the doctor has tried his best. Okay, this will give you full 16 out of 16 marks in the communication skill. Just a few sentences, the tone of your voice, empathetic behavior, and touching each and every point in such a short time. Okay, and
Okay.
after this, yes, you asked about the consent. This is very important point whenever it comes to any procedural counseling. But when the patient is not competent, like in this case, you should ask about the advance directive. You should ask about the wish of the patient. At this moment, when the surrogate was telling you that no doctor, I don't think so that my father is willing, or my father will have this procedure now, so you will ask that do you have any knowledge about your father wishes in this regard, or your father has any advance directive. I don't think that you need much knowledge regarding this, because in the previous pattern there was 5 minutes viva. They asked each and everything in detail. But luckily, which this is what I think, na, कि just you need to touch these points, so that the examiner know that he or she, the candidate, has touched all the ethical issues as well as all the legal issues. All right. I think less than 1 minute is left for this recording. I will share the link again if the recording stop, this Zoom meeting stopped. Okay. So, okay, Dr. Faiza, am I audible?
Yes, Dr. Mubasshra.
Okay, I think I have discussed the point of advanced directive.
Yes, you were discussing that.
So you will just need to ask whether your father has any advanced directive. If he has, he will tell, or you will go accordingly. Or if he say no, then you will carry on. And then one thing which I think you have missed is that in any procedure, you will in the end say that you will give just a warning sign or a warning shot, something like that. That if in case your father experience any pain, bleeding from the site of the procedure, or any discharge, please come back to us immediately. Okay.
Okay.
And always try to cover the social support as well in any communication scenario. For example, in this case, when the candidate when in this case, like he was saying that just For example, in this case, when he was not feeling, or at least he was not convinced about the procedure, he will say that I will give you time to think. Yes, this was very good sentence that you were saying, that yes, you have the right to think about it, but you can add that we will discuss this later on in the later part of the day, because as you said that this is a life-saving procedure, it is very necessary for him. So you will just give him time for a couple of hours, and you will say that we can discuss this in the later part of the day, all right? And you will give some social support. For example, you will say him that I can give you certain leaflets, brochures, or some website address so that you can get more information about this procedure. Okay.
Okay.
And uh, this was all about this procedure. Okay, this communication scenario. Any question?
Yes, Dr. Mubasshra, I was saying that we have to talk about advanced directive or living will only if he becomes angry or if he just refuses to this procedure. In that case, I have to talk about advanced directive, na? Otherwise, if he is just asking for concerns, then I don't have to ask for the advanced directive or power of attorney or anything like that.
Yes, yes, this is like that, because mostly what will happen that for example, if they don't get convinced, this will not cut your marks. They just need to check your that skill, that whether you will go towards the advanced directive or not. Okay.
Okay. Okay. Yes, Dr. Mubasshra.
So any question from anyone, or you can write in chat box, otherwise I will just stop this meeting.
Thank you, Dr. Mubasshra. It was very nice
Okay, thank you so
session.
much. Thank you so much. I think no question from anybody, then I will just stop this meeting. Thank you everyone for joining. Allah Hafiz.
Allah Hafiz.